guys, welcome to our collaboration with the Ketchikan Wellness Coalition called Healthy Minds. I am here with Janai Meyer, lactation consultant, and
registered dietitian nutritionist.
she's got a lot of titles.
I do.
Which means you are an expert in this
No.
topic. I'm Brittany Pope, and I'm a licensed professional counselor and a certified rehabilitation counselor. So I guess we both have a lot of titles.
A lot of alphabet soup.
Right. So last segment we talked about mindfulness, how mindfulness can help you, how mindfulness connects to your mental health. And so I contacted Janai because she is like, with her alphabet soup, a professional and a highly regarded, like just expert in this field, in my opinion, as evidenced by
My biggest fan.
as evidenced by your work in the community. You've been in the community a long time. Do you mind just telling us a little bit about what your experience in the community is?
Sure. Well, actually, my family's been here for multiple generations in the community. They hail from Myers, which is a small community outside of Ketchikan. We settled here after college and decided it was a place to raise a family, so we've been here.
Nice. I didn't realize you were from Myers. Wow.
Janai Meyer.
Oh, funny. Okay, it's named after you.
And so I have two teenage boys. I've worn a lot of different hats in town.
Okay.
But,
Okay, so now you're wearing a nutritionist hat today to tell us about. Really, the focus today is mindfulness and nutrition, and Janai's going to talk about intuitive eating, mindfulness associated with that, and really give us a good overview. And maybe you can leave here today watching this with a few tips in regards to some things you can try at home. And so again, we're not going to be talking about like any fad diets or anything like that. We're really going to be talking about mindfulness and intuitive eating, and we'll go more into detail in regards to what that is. But just to recap from last segment, since you weren't here, we talked about mindfulness, and mindfulness is the art of being present. I mean, that's the definition of that. What does that mean, right? What that means is you're being present in your own life. And whenever we experience certain stressors or anxiety or depression, it can actually create a gap and cause us to not be mindful. And so I think we experience that a lot in eating. And so that's why this topic is so connected with eating. I know when I watch TV at the end of the night and I grab a bag of like popcorn or something like that, I'm not being mindful because I'm continuing to eat and focusing on something else. So let's just talk about it. Let's open up the floor here and talk about what is mindfulness and what is intuitive eating.
That's a perfect first question on intuitive eating. Intuitive eating is actually kind of our default mode on how we feed ourselves. I mean, we're all born with the innate ability to know if and how much we need to eat. I mean, if you've ever watched an infant when they're hungry or when they're full, it's very clear that their cues on satiety and fullness and hunger are sharp.
Right.
And so that's a mind-body connection.
So their brain and their body are
physical.
connected, are in saying, after I breastfeed, because if we're talking about an infant, I'm full.
Right.
So that that's fascinating.
And the interesting thing is that we're all born with that skill. And what happens in our society is we are then socialized into an area of diet culture, which could be an entire show of itself.
Right.
And when you swim in the pool of diet culture, you start to disconnect that mind-body innate relationship of when the body's hungry, it tells the brain sends out an appetite for something to eat. And when the diet culture kind of severs that communication between the brain and the body communication, when you say, okay, I'm craving this, and your brain's like, the diet culture messaging is, oh, we can't because we're counting calories or carbs, or there's a severing of those relationships.
Totally.
And so then you can't truly respect and trust the body, doesn't trust the brain, and the brain doesn't trust the body. So we get into this disordered of eating, and it is a spectrum, but if a chronic dieting can be seen as fighting the brain and the body, fighting what the body truly needs.
So it's almost like the connection highway, because I always say that our heart and our head are connected. And when we detour, or there's we just had an earthquake, let's say that connection just got rumbled and broken apart. And so kind of what you're saying is your brain and your body aren't communicating. You're in a healthy way.
And it's the socialization of, no matter what size body you're living in, everyone's trying to lose weight. And there's all these nutrition messages that are forcing that. And so it can really derail someone's their desire to honor their body's physical hunger and fullness cues. I have a short little story. I like telling stories. That's okay.
Yeah,
to
tell
kind
us the story.
of demonstrate this. But my oldest son, who is now away at college, but he was 4 or 5, and I set him up for breakfast at the table, and I had to go take a shower, and a family member was watching him who doesn't really participate in this intuitive eating philosophy, but I needed to watch him. And as I came out of the shower, I heard my son crying, going, but I'm full, can I be excused? And then I heard this adult going, no, your mom made that for you, your plate's still full, you need to finish it. And it just kept repeating, it kept getting elevated. And my son at 4 or 5 was trying really hard to explain to this family member, but my body's telling me I'm done, my brain's telling me I'm satisfied, I want to be excused. In the same aspect, he was trying to honor the culture of our family and society by honoring this adult in the family.
Right.
And so he was just torn, and the tears started flowing.
Wow.
You know, and it was just,
powerful.
and it was, to me, I look back in that as the fine example of when that child is starting to be socialized into that diet rules, restrictive culture.
Yep.
I want to do this, my body wants me to do this, but I'm being socialized to do this. Clean the plate, eat because it's here. You know, and so I think about that as a story of what we all are struggling with.
Well, and I know, growing up in a relatively low socioeconomic status, I mean, my mom, we didn't have a lot. My mom was a single mother, and so when she would say, you can't leave till you clean your plate, we may not have known where our next meal was going to come from. How, when you look at different socioeconomic statuses, let's say there is the fear of not having the next meal. How does that affect the intuitive eating?
Well, and food insecurity, believe it or not, is a negative side effect of chronic restrictive dieting. If you think about it, people always start a new diet on Monday. Why is that?
Because you start routine on Monday.
Because you know you're going to have this restriction. So then you binge all weekend. And no one ever starts a diet on Super Bowl weekend, right? I mean, you just don't do these things, And so, I mean, we actually can, even with having the means to feed ourselves, put our body and brain in this distrust. And correct me if I'm getting off topic. I meant to answer it. But it doesn't have to actually be physically an inability to have the food. It can be the perception that I can't have it or I can't get it.
Okay, so like if my, and I'll just use my family situation. If my mom, it probably didn't register as like a 5-year-old, where's my next meal coming from? Because she always made it happen. So it might have been more for her. But let's say I didn't know where it was coming from. Could that long-term effect of that safety and security affect my response to food?
Oh, absolutely.
Okay.
Yeah, absolutely. And there's lots of different root causes for that, of course, on the spectrum of what would cause that. But I think I answered the question. I guess I'm a little confused on that. But I mean,
No, you totally answered the question.
Okay.
I think what I heard you say, just to clarify, is that when we have the social expectations or this disordered type thinking, that it can actually create lasting impacts in that intuitive eating connection with your body.
Well, and that's where mindfulness comes full circle. And to be honest, mindful eating is different than mindfulness as it relates to intuitive eating.
Okay.
I feel like I need to slow that down a little bit because if anyone's looked or Googled mindful eating, you're going to see these people slowly unwrapping a piece of chocolate and you smell it.
You're
it's
clearly
this
not at
huge
my kitchen
environment.
table.
Yeah. But I mean, so mindful eating is the practice of tasting, smelling, appreciating the food that you're eating.
Right.
Mindful eating. Mindfulness, which you covered last time and you summarized really well, is just the ability to be present moment. And it can be really quick. I mean, just before talking today, I was trying to be quiet and mindful and bring my brain and my body to the same space through some breathing and calming and visualization. Yeah. And so whenever you do that, when you bring your brain and your body quietly in the same space, what is the benefit of that? You're able to
think, you're able to be present, you're able to maybe
identify whatever's going on, right? I mean, you think about it, it's that inventory check.
Totally, like an assessment. Hey, what's going on in my day? And I always tell people, check in with yourself at every meal.
Well, and the interesting thing is you can use the mindfulness, and it could take you 30 seconds, 40 seconds to get in that space with practice, with some breathing. But when you're in that space, and your brain is all over the place, that's just normal. That's a normal process of trying to slow yourself down and find balance. You could actually be saying, oh my goodness, I'm hungry for X.
Totally.
And that's part of the inventory and checking it. And when you do that, you've just reconnected that highway that you were born with.
And that intuitive eating.
And then, of course, if you have been raised in our society, then you get this message: carbs are bad. Eat this, do this. Is it on my diet? And it's like, and so you just severed that again. And so mindfulness is a trust that goes both ways, and between the mind and the body, and the body and the mind, but also being able to identify. Because I've had people tell me, I've been dieting for 40 years and I have no idea what hunger feels like. If I don't have something to tell me when and how much to eat, I could never identify it. We all have that ability. Would you tell someone, everyone has that ability to recenter and connect?
Right.
With practice.
Right. Well, and yeah, totally.
So the mindfulness practice, which any degree you want to do, actually allows you to identify and start to, act on what the body is telling you as far as hunger, fullness, and satiety, but also satisfaction. That's a big piece with why we eat.
Can you define satiety?
Comfortably full.
Okay. Thank you.
Comfortably full.
Yeah, that's helpful.
I think that would be, we've all been uncomfortably full.
Thanksgiving.
Yeah, that's consuming more than your body probably needed at that moment. But everyone does it. I mean, the thing about intuitive eating is it is not perfect.
Okay.
They're not butterflies. And,
oh, wait. So we're not in this like perfect snow globe at the dinner table eating like vegetables, fruits, and having this perfect family gathering when we're intuitive.
No, and it's the best you can for now. But it's also paying attention that I do need to fuel my body. And it is self-care. And the interesting thing about it is when we talk about mindfulness to bring balance and connection, to do an inventory of what you need. And at that inventory, it may not be that you needed to go for a walk right this moment. Maybe you actually needed to fuel your body, but you've been pushing it off all day for whatever reason. I mean, and intuitiveness is knowing that this is good enough for today. This yogurt as I'm running out the door is good enough for now, and I'll take care of that later. And nutrition does come into play, but when you look at the 10 principles of intuitive eating, it's the last. Gentle nutrition is the last principle. The first principle is reject the diet mentality, because mental health and physical health are so intertwined with how we feed our body.
It's
and
totally
how
true.
we take care of ourselves. So self-care versus self-control, it's the kind, relaxed, intuitive way to nourish your body.
Well, and that's so true. So I know last night I made chili. So I had it for dinner last night. I had eaten a salad. I was good to go. And then about an hour later, my body's saying, you're hungry. And I was like, well, that's weird. So I'm looking at my cabinets trying to find something. I couldn't find anything that sounded good. Then I drank water, and I was fine. My body was telling me I had a need. I assumed it was hunger, but it was really, hey, you're thirsty. You got a need going on here. So I think what you're saying is self-control versus self-care. If I don't drink enough water throughout the day, I'm going to need a lot of water before I go to bed because I'm used to a certain level of hydration, and my body was communicating that to me. But I think we always go to a default sometimes of food because it's an easy access. For me, it's an easy access. Is that?
Well, it is, and one of the principles of the intuitive eating philosophy is that, you learn to cope without the need for food, to your emotions, and you have to kind of unpack this, and so unpacking it is, first of all, realizing that you are driven by society's expectations of how we're supposed to feed ourselves and take care of ourselves. And you can't trust this.
Yeah.
You have to trust that, and so rejecting that mentality, but also part of it is working through, am I numbing out and coping my emotions with food? Back to mindfulness, because if you were to do the mindfulness, let's say that, in your situation last night, you had the dinner, you honor the fact that, okay, there's a signal coming here, I need something, and if you're one of those people that might have a tendency to binge, or like you feel like you can't control the volume once you get started, the good thing to do is to sit down and do some mindfulness reflection and let that inventory speak to you, before you get through, the next eating, because you really do want to slow things down. For you, you're able to identify it's water. But that, to be honest, that's a journey that takes people years to get to that point.
Right. And for me, now you're putting a name to intuitive eating. That for me, like, I almost feel like I'm like, aha, like in a therapy session or something. Like, whoa, that was mind blowing for me. And I think for me, my journey has been binge eating. I would, at the end of the day, if I didn't eat enough food, if I don't eat balanced meals, I will binge eat at the end of the day. So I know that about myself. So I try to I give myself options. If my body's still saying you're hungry, then I go to like yogurt or an applesauce or something that's really light right before bed so that I'm not, binging before bed. So would you recommend?
So self-care. You just described
right,
self-care.
Right.
Versus I'm going to go to bed hungry, which is going to really set me up.
I was about
for
to
a
say,
binge
would
the
you
next day.
recommend that someone, like, it's balanced, right? Someone who maybe has a history. Obviously, if you have a history of an eating disorder,
oh yes,
you have to get treatment.
Yes,
that's a whole nother level.
But intuitive eating. The two researchers, which were fellow dietitians, that came out with this principle in 1990s, and to be honest, it saved my career in this field because I couldn't tell anybody else to eat any more fruits and veggies with good conscience. I didn't think that would do anybody any good. Nutrition knowledge is everywhere, and I don't feel like that's necessarily a good registered dietitian's nutritionist's job is to tell you what. No one should tell you what and how much to eat, for the most part. And that knowledge is out there when you're ready to find it.
Right.
The job of a good nutritionist is to actually help you reconnect that mind, body, and feed yourself well. So to get to your subject, get to the point is that I think that being mindful that I need to self-care. I can't go 6-8 hours without eating. I know I need to eat. And the binging, it's interesting. If we're talking about an individual who doesn't have a history with eating disorders, because that can be triggering, or someone who has another medical condition, someone living with diabetes or something, that's a different conversation, or blood sugar control. But the interesting thing is when the person knows I need to eat, then you apply those gentle nutrition philosophy, which is, this is good enough for now. I need to eat that light snack before bed. Otherwise, I know what's going to happen tomorrow. It's back to fruits and vegetables. It's like this. But if you wanted to have the Girl Scout cookies, which will hit our town here in a month, you could have had the Girl Scout cookies, And so it's okay.
Thin mints. They're my nemesis.
Part of the intuitive eating is letting go of that, rejecting the dieting mentality that there's good foods, bad foods. There's a perfect way to eat, and that clean eating will prevent you from having disease. We know that's not true. That's not evidence-based.
Right.
And so being aware that we can only have so much control,
Right.
So the idea with the intuitive eating and the mindfulness piece is just slow things down, and really try to take inventory and trust. And once you start to trust your body will trust you, and it won't send you on those binges. Is where I was going with this. Is once it realizes there's not a feast or famine, chronic dieting, restriction, binging cycle, there'll be less extremes.
Well, and see, it can also be a protective factor. That is a lot of things I talk with clients about. Like, food can be feel safety.
Oh, it's nurturing, and it can numb, and it can do all kinds of
imagine, man, sometimes a big piece of chocolate cake feels real safe.
And, in the intuitive eating philosophy mindset, that's okay. We don't have to always eat for nutrition. Oh, my goodness, if we ate just for nutrients, how boring would that be?
I'd eat a lot of spinach.
What would you have had for your birthday?
I had a lot of food.
Right, because it's celebration.
Yes.
Food is part of social and celebration, and so we honor that. And the fullness spectrum of that can be scary for people, because I think people that are worried about their body size and they're getting better, and I say body size because we like to connect the word weight and health, and we know research shows that there's not a direct correlation between the two.
Right.
And so when someone is worried about their body size, we know that chronic dieting, whatever the external restriction forces, actually makes people bigger long term and less healthy. And diets are designed for failure. They're designed so you come back and buy it again.
Right.
They're designed so you pick up the next book. If there was really a way for it to be successful, they would be out of business.
That's
and be mindful that you are marketed billions of dollars a year.
Right.
I think it's like $65 billion a year to find some book, something that's going to make you go on the next. And it's not that I don't want people to not have hope. I want people to have hope, to be well and take care of it. But I trust that it's in here. It's in here. It's in here. You can do it yourself. You just need to find. And it's a long journey. It's not a linear journey.
Right.
It's a zigzag pattern and
figure eights and going back to the right. Yeah. Well, and I think it's also, in a sense, when you are slowing things down and you are doing that inventory. Let's say you're making this goal to eat healthy. Like, that's your goal. I want to eat well-balanced meals, and I want to feed my body, right?
Sure.
And I want to be active. Let's say that's your goal. Slowing down and taking an inventory checklist I think that's a great technique. Do you recommend certain questions? Is there a certain template or format people should go through?
What I work with my patients is just the first thing I try to get them is to get them some balance. If they're skipping meals, if they're consuming all their food at once at night, or the nutrition has to wait. I know this sounds weird coming from a dietitian, but the gentle nutrition part has to come after you don't care anymore about the dieting mentality. You have to build on the fact, you have to get through rejecting the messages that are coming in your head about what you should and shouldn't eat. You have to get through the emotional connection. You have to identify fullness, and then you have to identify hunger, and then you have to do some gentle movement and self-care. So a lot of things have to come before we can start really picking at the what, and the what really does belong to the individual. Back to, no one should tell you what to eat and how much to eat. That you can Google that and you can know exactly what you're supposed to eat. You can follow anything online. But the interesting thing is, so I try to figure out where the big gaps are for people, and if they're missing let's say if they're missing an entire food group or a macronutrient, there's no protein in this, I'd be like, if you want to feel a bit better, have some more energy, we need to kind of get a little bit balance on your macros.
Right.
So I give them that tool to get them through the next step to the journey. But it's just a tool, and they need to drop that when they feel like they've got that intuitive piece and that balance down.
Right.
So I'm stumbling because I don't have a checklist, and I'm trying to see if I have one. But I think that it's important to realize that it is a process of rediscovering and listening to your body and letting your brain and your body talk, but also knowing that there's going to be forward movement and backwards movement and forward movement and
So
backwards.
accept the journey, like in a sense of like, don't be so hard on because it's all mindset. What I hear you saying is that mind is powerful.
Mental health is huge when it comes to choosing to self-care and feed yourself.
Totally.
Hands down. And our diet is more than just the nutrients we put in our mouth. It's the people we surround ourselves with.
Oh,
it's the
yeah.
activities we do.
Right.
Our actual well-being is based
Financial.
on all the input.
Yeah.
Not just from fork.
Right.
And that can affect. So the other thing I do if people are really stuck in letting go of what they should do, right, is I have them just start journaling a little bit about if they say, try to take that. I teach them like a 45-second mindfulness, just kind of come into it wherever you are, and try to think about what it is you need. Is it food? Is it quiet time? What does it need? And if it's a food, identify it. And if they say, okay, I want that, I'm going to throw the word out there, a bagel and cream cheese or whatever. And I said, check your immediate response to that. And if your brain says, no, I can't have that, or I've already had my carbs today, or whatever, oh, that's white, that's sugar, that's bad. Whatever the immediate, that's the dieting culture interfering and severing your connection. And so write it down. You don't have to act on it, but just say, my body told me I wanted this. And I immediately got a, no way, lady, you can't have it because of this. And so try to figure out where the messaging's coming in to derail you a little bit.
Is it okay to negotiate with that voice? So is it okay?
For example?
So like, I want a bagel. Well, hey, I don't want a whole bagel. I just want half a bagel. Or is that unhealthy disordered thinking?
It's not unhealthy, but it goes back to like principle 7, I think it is, which is finding your comfortable fullness. So if you wanted the whole bagel, by all means. If you're happy with half and you find that comfortable, and there's the whole session on comfortable fullness is back to exploring and taking inventory and figuring out where your comfort level is. Yeah. So negotiation is a good way because you're negotiating with yourself.
Right.
But you're also letting yourself know that if you do eat the other half, there's no guilt and shame. And that's part of the downside of this is that guilt and shame of I broke a rule. I did something wrong,
Yeah.
When you
totally. Yeah. Shame triggers, they're like little gremlins on your shoulder, like sitting there barking at you, and they're protective. Like I always tell people, they're not going to go away. You're just going to become more aware and resilient to them.
Exactly.
And so it sounds like, this intuitive, like what's going on isn't going to go away. You can suppress it. You can use these unhealthy coping mechanisms and suppress it, but it's still going to be there.
Well,
so
in our
it's learning how
culture,
to
we
use
swim in it. It's everywhere around us.
Yeah.
Everyone's trying to change their body.
I feel like I'm getting a whole nutrition session here. Like, this is amazing.
When I did, so funny is I don't actually talk about nutrition. I mean, I do talk about nutrition eventually. But, and other things that I try to, other things that I help to tease out is, chronic restrictive dieting is on the spectrum of an eating disorder. And so I don't diagnose that, but I refer people off. But I mean, if people are binge closet eating, or if they're doing behaviors that are very on that spectrum, if you find yourself, so a couple of questions I do ask, now that I think about it, I had just to pause for a second, is that, if I ask people, do they eat differently in public than they do in private? And that is one of my biggest insights, that there is a strong force that's interfering with their ability to self-care by self-feed.
When it's almost too permission to just open up. Like, I mean, you just asking that question, I'm like, oh yeah, those Girl Scout cookies coming up, I would not eat those in public. I mean, because it is true. We have these thoughts of like, this is shameful to do this in public.
Right, and there's a stigma to it. I mean,
Totally.
there's a weight stigma, and there's a shame to it when, in reality, if you're self-feeding yourself based on intuition, back to that newborn, and I work with babies all the time, and is that they're so well versed to do exactly what they need. They feed on demand. They stop when they're full. We all can get back to that self-care and that health that we were born with if we just let the communication happen, and occasionally let the Girl Scout cookies happen. Back to the thing. So the gentle nutrition piece, I'll get to that because I know people are probably wondering about that. When it comes down to actually address that, that's where we get in a little more detail about the what.
Okay, so the purpose.
But you have to unpack all the tape that's holding you back from doing that. you know, and that's the dieting mentality and the culture and the food dogmas and dieting dogmas that we're all wrapped in. But you know, so like for example, I was just reading an article last week, and I thought she wrote, I can't remember her name, but she wrote a really good summary about intuitive eating and gentle nutrition. But her big purpose was, like for me on purpose. Like say you have one of those busy weeks, you've been traveling, I know you were traveling, and we eat different when we're traveling, and we have family in town or whatever.
Right.
And you intuitively know, I think I need a little more green leafies in my diet this week.
It's so true.
And so what that is, it's not that you're being told you have to eat your kale or whatever it is. But you just intuitively know, my body needs some roughage.
Yeah.
It needs some fiber. It needs some green. I'm feeling it's time.
Yep.
And so that is an intuitive eating response based on gentle nutrition,
Right.
but also honoring what's going on in your life and where you are. And so it could be the same thing with anything. You know, I didn't really eat a whole bunch of calcium last week. I probably should get some yogurt. You know, you just kind of, it doesn't have to be meal to meal and deal today perfect. Back to, we're not looking at perfect.
Well, yeah, and
Wasn't the big picture good
perfectionism.
enough?
Well, darn near, like it's a hiring expectation. Every time I meet this one, then I'm going to go up. It's called the hedonic treadmill, a mental health term.
Learn something new.
Yeah, and it's essentially you are on this treadmill of really like these expectations. I'm never going to meet them, but I'm going to stay on this treadmill. I'm going to get stressed and I'm going to get anxious, but I'm setting these ever-moving expectations.
And the nice thing about this relaxed, comfortable, intuitive response to feeding and caring for yourself is it's very research-based, and that's what I wanted to kind of end.
Totally.
And the two researchers that originally brought it out in the 90s, which has saved my career, like I said, they came out of an eating disorders treatment career. And this is one of the major philosophies that is in treatments programs that are used to keep people that have gone through that treatment from relapsing. And so intuitive eating is very well researched and grounded to normalize someone's relationship with their body, but also how they're caring for it through feeding it.
So I love a lot of the things you say. So I want to just bring out a couple key points from what I heard today, just so we can share it with the people watching, because this is just such a gold, like I'm so jazzed on the inside about this. So really that inventory, that self check-in, where am I at?
And your mindfulness
right.
practice.
So your inventory is individualized to yourself. It's not one general set of questions. Typically what my inventory would look like is, did I eat lunch, depending on what time of day it is? Did I attend to my needs? Did I do my stretching? You know, just the general routine that I do throughout the day, which seems to be pretty healthy for me. But for you, it might be, well, did I walk my dog? Did I eat my breakfast? Did I eat my lunch? Like you might just have to go through your daily inventory where I can maybe do just a meal by meal one. And then also I heard that intuitive eating is that communication highway between the brain and the body. And when we are looking at maybe like, and we're not picking on fad diets, in a way. Well, I mean,
I am.
Yes.
That's a whole other story.
Well, that's a whole other story. But we're not saying like, you know, that's bad.
If it works for you,
yep,
I support that.
Yes, exactly.
But if you find yourself getting off of something and back on something again, time to reflect on what that
exactly. I love that.
means.
I think self-reflection, and that's what you kind of said throughout, is self-care and self-reflection. You mentioned too your environment and the people around you also drive that mindfulness and self-care. Mm-hmm. So if you're around a bunch of people that think it's okay to work 15-hour days and not eat all day, that might be a culture you start to acculturate into because it's the expectation. And so I think it's really important to take a look at your support system around you and your boundaries within that.
All the input that you bring into your body, into your day, into your mind.
Yeah, I love it. So input into your body, into your day, some journaling, some self-care, intuitive eating. How can we get a hold of you?
Oh, well, yeah, it's janaimeyer.com is my website. I'm easy to find in town. You can find me. Ask Brittany.
You can find her anywhere.
You can find me, yeah.
And, you know, really, she does registered dietitian, lactation consultant, a lot of wealth of knowledge. This has been so helpful. I'm Brittany Pope, LPC. I'm like Janai, you can find me anywhere too. And this has been on mindfulness and intuitive eating and how to incorporate the two of those into your nutrition.
Thanks for
Can you say
inviting
that's
me.
a good?
I think that's perfect.
Okay.
Thank you.
All right, thanks for joining us today, guys, and we'll see you next time.